talk about the
Good
last time
evening
we
po.
talk about the yung meaning ng public health. According to Winslow, this is AS and 3P no with OC. AS 3P OC. Meaning is an art and science or science and art which deals with the 3P prevention, promoting and prolonging life through organized community or organized effort, individual or by community. Yung pinaka-essence ni Winslow, very until now, yan pa rin ang ginagamit yung objective niya kasi kasi related sa public yung course niyo public health administration related dun sa meaning nun ng through organized community. The essence here is the how to paano malalaman yung organized community yun ang very crucial. Sino yung mga organized community dun sa isang locality na yon? Kasi halimbawa sa isang region, identified yung mga organized community na yun. Different localities has different organization, how to deal with them, no? How to deal with them. Actually, yung mga local health board is sa Pilipinas, yun yung isang susi dun sa meaning ng public health. Yung local health board, pinaka-chairman nito is the mayor plus the city health officer or the municipal health officer downline dun sa mga locality including yung mga NGO kasama dito. Kaya nga I think ika-second year niyo na ba or siguro nung basic ng public health na introduce sa inyo, the pillars, very important, the pillars of primary healthcare approach, the the pillars of primary healthcare approach, yung apat na bagay. Very important yung apat na bagay nito is in doing something or project gagawin mo sa community, always remember the four pillars. One is the active participation of the community. Dapat palaging kasama si community palagi eh. When we talk about the community, not only the community people, yung mahirap hindi yun eh. Including yung mga NGO, including the non-government organization, the government organization, sangguniang kabataan, mga organization available do sa community. Dapat kasama palagi siya sa pagpaplano. Number two is the yung inter or intrasectoral linkages, no. Very important parang parang magkapareha sila pero the inter or intrasectoral linkages, international outside the community, intra within the community no or within the locality. Identified nyo na kung sino pwede makatulong dun sa inter or intrasectoral linkages. Number two is the support mechanism. No, palaging support mechanism. For example, in doing sa project sa local government, ano yung makakatulong? Kasi hindi palaging DOH, hindi palaging ganun. Hindi palaging kami yung sa health, kami yung magtatrabaho dito. Hindi. It's a effort talaga ng mga kasama sa local government, yung mga departments sa local government, like for example yung mga engineering kasama yan, yung mga DSWD kasama siya. Tapos ito nung kwento ko lang, share ko lang sa inyo kasi nung time pa ako sa health ako, si Mayor Bayani Fernando yung aming mayor noon. Yan talaga ang kumbaga siya yung chief executive officer ng Marikina. Palaging on top, nasa utak niya palagi ang kalusugan ng health. Palaging binabagyo yung Marikina, di ba? Pag nagbagyo yan, meron na yung whiteboard sa central station. May whiteboard yan, tapos naka-delegate na, eto ang by area, eto si DSWD, ikaw ang assign sa ganyan. Ikaw engineering, ikaw assign sa mga equipment. in terms of ikaw sa police, ikaw fire sa ganyan. Kumbaga on that day, nililink niya na yung mga offices, the support mechanism, no, na andun. Although hindi naman sinasabi natin na yung ginagawa niya ay related sa pillars, pero titignan natin na andun yung effort in doing things na everything na ginagawa niya sa Marikina na relate sa health. For example, yung disiplina sa bangketa, anong relationship ng bangketa sa kalusugan? Di ba? Yung isipin nyo, bakit aayusin natin yung bangketa? Yung kalusugan. Sabi niya, hindi niyo ba alam, pinaka on top of my mind, sabi niya, is the kalusugan, sabi niya. Ang kalusugan palagi on top of my mind. Hindi ako direct na nagtumutulong sa health. Ito ay effort. Kung naayos natin yung bangketa, walang magtitinda ng mga sidewalk vendor. Mga sidewalk vendor ay yan yung mga gastrointestinal mga sakit sa tiyan, di ba? No, pag yung maayos na bangketa, meron sasakyan yung mga tao, hindi masasagasaan, di ba? Pag maayos ang bangketa, ayos yung manhole, hindi nasusugatan yung mga tao, no? Parang gano'n, no? Nire-relate niya palagi sa nire-relate niya palagi sa health ang everything na ginagawa niya. O yun yung support mechanism about the health. Yung final is ulitin natin, number 1, the active participation of the community. Number 2 is the intersectoral linkages, support mechanism. And number 4 is anyone? Yung number 4, the 4 pillars. Do you remember that? Yun. Hello, wala. Use the appropriate technology. Yung pinaka-last, Use the appropriate technology. Depende sa needs ng isang community. Hindi ka mag-iisip ng some spectacular, some high-polluting project dun sa isang area mo. Use the appropriate technology. Hindi mo kinakailangan CT scan, MRI on that area kung X-ray lang yung available mo, di ba? Yung mga kung ano yung technology na appropriate dun sa ganon sa isang locality, yun ang gagamitin natin. Yun yung 4 na pillars. In doing some project, these 4 pillars in primary healthcare approach ay ginagawa na naisip na to nung panahon pa ng Alma ata noong 1978 ng Alma ata. Sabi na health for all by year 2020. 2000, no? The year 2000 pala. No 1978, by year 2000 daw, magiging health for all, magiging malusog ang lahat. Sabi nung sa Alma ata. Pero nung 1990, binago siya ng health in the hands of the people. Ang kalusugan ay nakasalalay sa kanilang mga kamay. Yun na binago na. Hindi na health for all, hindi na siya naging health in the hands of the people. So kaya through that yung health for all no 1978, every department of health nagkaroon ng direction on the 12 areas ng health, 12 areas pa nung araw na mga maternal and child, yung mga different program, no? 12 areas pa yun. Ngayon dumami na siya. Pero kinategorize into 5 area. 5 area. Anyway, na-discuss na siguro to nung basic on the foundation of the primary health. The primary sa inyo before my subject, dapat meron ng introduction nito. Very important kasi siya in discussing this kasi yung ating topic is the preventive and community. Yung foundation nito is very important. Of course, sa reporting, Sa reporting na sinasabi na gagawin nyo ay, of course, na andito nakasalalay palagi. The pillars, no, the 4 pillars, what is the public health. Yan, with that, let's move on the ano ngayon. Nasa ano na tayo magre-report. Magre-report na excited ako marinig. Sino ba ang ating first reporter?
Sir,
First
si
report.
JJ po. Si Justin po.
JJ. Ready ka na, JJ?
Parang, sir, wala pa ako.
Wala pa.
Opo. Teka,
Oh,
sir.
Sino susunod?
Si Gerald po.
Gerard.
Si Doc Amy po, Doc.
Ay, ako. Hindi, malayo pa ako.
Gerard, ikaw yung unang ano.
Oh.
Si Gerard, okay.
Okay. Hala. Okay, good afternoon, everybody. Good afternoon, sir, Doc. Today I'll be reporting my topic about the preventive and community-based health. Actually, about health promotion and population health. That will be, if approved, included in the syllabus for the preventive and community-based healthcare course or subject. Okay, so let me share my slides, sir.
Yes.
Okay.
Gerard, before
Yes,
you proceed, pwede ba tayo mag-picture muna para labas po tayo? Mga 1 minute lang. Labas po tayo lahat. 1, smile tayo. Screenshot tayo. Naka-duty si Josephine.
Yes, sir.
Okay.
Kasi po, naka-quarantine yung isang kasama ko kaya.
Diretso yung duty.
Kaya po.
Okay, lahat na nandito. Singson, Faye, John Lloyd. John Lloyd pa rin nakasulat doon eh.
Si Beb, sir, ang wala. Tsaka si JJ.
Okay. Okay. Smile.
Ay.
Smile. 1. Smile. 1, 2, 3. Alright. Ayan. Save as. Okay. Sige. You proceed now.
Okay. Okay. So again, good afternoon. I'm going to report about the health promotion and population health. Aims and objectives. At the end of the subject, the students will be able to define the following terms, know the concept of health, health promotion and illness prevention, understand what is risk communication and its importance, to know more on health promotion and create an exciting, sorry for the typographical error, unexciting webinars, create an effective IEC materials, and know how to do social media marketing. Okay, so here, the definition of terms, there are 10. I put it here, and these are health, illness, community lifestyle, epidemiology, health promotion, risk communication, healthy population, target population, motivation, and inspiration. Sorry, inspiration po yan. Okay, but before that, I want my classmates to choose some words on the list, as I will give you like a minute to think of your own definition of these terms. I will be, let me just share. I will be having a little bit of activity. So as you can see, there is a ruleta. So there are names on it, and as I roll it down, I want you to tell us, the class, as to what word and what is the definition at your own or on your own understanding, because these words are very understandable, or we actually meet these words, but how do you define each of these words, or how do you define the word that you chose? Okay, classmates, is that clear, or would that be okay?
May prize.
May
Ano po?
price.
Bukas may
May
prize. Joke
May
lang.
price. Gcash, Gcash.
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 Sige. Ready na? I'll start the ball rolling. Okay, Bebs is not here, so let's roll the ball, or spin the wheel. Oh, actually, ni Justin. Parang ang mga absent ang pinupuntorya ng ng wheel na to. Ano ba yan? I'll just wait. Let me just delete those who are not here, ha? To be okay. Here. Getting. Let's start. Okay, Ma'am Amari. Choose one word of those list on the definition of terms, and please tell us as to how do you define such word? Hello?
Pwede pong makita yung list.
Okay. Sure, no problem. That is here. Yan po.
Kahit ano daw.
Yes.
Stress.
Choose your own word. Just a word.
Own word.
Yes.
Ano ba?
Epidemiology.
Sige. Health promotion na lang.
Sige. Okay. How do you define, or for you, what is health promotion, Ma'am Amari?
I think health promotion, from the word itself, promoting health, and actually it's like we're enabling the community or an individual to improve their health. Okay. By having letting them have a control over some factors na like for example kaka-stress. So yun, health promotion, it's like we're enabling the individual or community to have a control over their health, being healthy in particular,
yeah. Actually, you got them. Yeah, you got actually the keyword there. Okay, thank you. Yes, it's relax lang po. Okay.
Thank you.
Okay, next one. I want to. Okay, so health promotion there is finished. Yes, Dr. Amy. Ay, di pala.
Teka.
Noel pala. Si Sir Noel. Si Sir Noel pala.
Kaya hindi nakikita yung roleta.
Oo nga.
Ay,
Hindi ko may kaya.
Wait.
May daya.
Pag natawag mo, tatanggalin mo yung pangalan, di ba?
Oo.
Oo, ganon.
Sige. Okay, wait. Ito na.
Bakit sa
Okay.
ulo may recitation pa.
Yes.
Ba't inulit? Sinuwel
Ba't tinulit pa?
Sige. Ma'am Mitch na. Para fair.
Po, di ba
Okay.
sila
Hindi,
pa?
joke lang.
Sir Noel pa?
Sige, ako na po.
Sige, Sir Noel. Okay, Sir Noel.
Um, I'll go with the word community.
Okay.
Oh my goodness.
Community, in my own meaning, is an area or a specific location or group of people or individuals that are living together
Mm-mm.
with the different ages,
Mm.
gender, um, along with the presence of diseases and so on. Yung parang ganun po.
Okay. Thank you.
Thank you.
Yeah. Thank you, Sir Noel. Okay. Let's go to Ma'am Mitch.
Yes, sir. Asan yung pagpipilian?
Ito. Okay. I'll give it to you right
Oh
now.
my God. Nantok ako.
Okay. Here. So community and health promotion are done. So what word would you choose?
Health.
Okay. So what
Health.
is
The
health
absence
for
of
you,
disease.
Ma'am Mitch? Ah,
According to World Health Organization, no, no, health defines the state, the condition of being free from disease
mm-mm.
and have, ano ba? Ano pa? That's it. Wala na akong maalala.
Okay. It's okay. Thank you. Thank you, Ma'am Mitch. Okay, let's go to the last two. Can I just point out like Ma'am Josephine?
Yes.
Yeah,
Okay, my take is on the illness.
illness. Okay.
Yes. Illness is deviation from the optimum functioning
Mhm.
of a certain system of the body, or um, the deviation from optimum functioning, not
Oh,
only for the system but also with the health or well-being of a certain person or a group of person.
okay. Very well said. Thank you very much, Ma'am Josephine. And Doc Amy, you're the last.
Saglit, ingay ng aso. Ako, sorry. Epidemiology.
Okay, Doc.
So, it is actually a study of distribution and natawag mo dyan, mga determinants of health
Mm-mm.
or in relation to health and in a specified population.
Okay.
Hindi naman to graded, sir.
Thank you naman. Hindi naman po.
Papawisan ako.
Pang relax lang. Okay. Thank you very much, classmates, for those answers. So, okay. So, these are some of the definition. I will not read it kasi di ba, Doc, may time limit tayo? 30 minutes lang. Doc and
Wala si JJ tsaka si Debs.
Yes, yes.
may time limit tayo. So, I'll just post the definition of the terms. So actually, most of you or all of you are correct with your answers. I just want to reiterate that risk communication is the interactive exchange of information about risks. Risk assessors, managers, news media, interested groups, and the general public. Population health, outcomes of a group of individuals, including the distribution of such outcomes within the group. So target population is very self-explainable, and motivation and inspiration. So these are just the terms that we'll encounter as we go along the way. So let's go to the concepts of health. Now, in the interest of time, since this concepts of health is a very big and broad topic, Doc Enric. So I just chose the which for me is relevant to my report this afternoon. Hope you would consider. So health and history. So why we are concerned about health? So health is a changing concept. So there are actually four. We have biomedical, ecological, psychological, and holistic. Biomedical concepts or shall we say the absence of disease, which here on the slides, human body, for example, is considered as our the machine. But because of the disease, the consequence of which is that machine can possibly break down, and the doctor is considered to be the mechanic, or what we call, or the ones who repair that machine. So its limitation, it has minimized the role of environmental, social, and psychological and cultural determinants of health. For the second part, we have the ecological concept. So health, for ecological concept, health it's a dynamic and equilibrium between man and his environment. Thus, disease is a maladjustment of the human organisms to the environment. Now, this concept supports the need for clean air, safe water, ozonic layer in the atmosphere to protect us from exposure to unhealthy factors. Next, the third one is the psychosocial concept. So, health is not only a biomedical phenomenon, but one which is influenced by social, psychological, cultural, economic, and political factors as well. Now, it was also discussed last week. These some factors that also affect, as what the illustration was made by our professor. So we enumerated such factors, which is the political, the socio-economic, the cultural. So these are um, uh, examples of these uh, in which psychosocial concept is involved for the concepts of health. So let's move on to epidemiology. Uh, we actually had this lesson already, but I reiterate the triad, which is very important. This will help our students, or the learners, to be more familiarized with what this is all about. So as you can see that there are three, which we have the agent, the environment, or the environmental factors, and the host. So these are interrelated with each other, that can also, if one of which has if one of which, shall I say, uh, one of these factors, or one of these factors will bad down, or shall I say, be uh, what's the right term there? Parang ma-compromise, then we cannot say that this,
Imbalance.
yeah, the balance will not, or it will not be balanced. Okay, so we all know already about the physical agents, the chemical, which involves the physical aspect of the individual. The chemicals, if those toxic agents, biological, these are the parasites, the virus, the bacteria, and nutritional agents. These are, of course, from the word nutrition. So yung parang yung intake natin, that can affect the agent. Now, so as with environmental factors, we have physical, biological, and social environment. And so as also with host factor, the social demographic. So when you say social demographic, this is uh, included, or this is related to how this person, or does this person have, uh, for example, meron ba siyang trabaho, or meron ba siyang uh, enough ba yung uh, ginagawa niya for his day, or for his daily living, parang ganon. And then also with the psychosocial factors and the intrinsic characteristics. So moving
Eh,
forward,
can I add something?
yes sir.
Uh, ito yung naalala ko yung nag-aaral pa ako ng MPH, ano. This triage, yung triangle, ano, isometric ba tawag doon? Equal siya, no? Yung apat na yan. Tama ba? O dapat equal sila, parang ganon. Kaya ano naman may equilibrium eh. Sabi ng aming professor nung araw, dapat may balance etong tatlong to. Kasi may, ano ba, environmental factor. Meron daw sa Earth na hindi livable. Meaning, hindi pwedeng tumira yung tao doon kasi sobrang dami ng lamok. Parang ganun, no? So, pumapatay yung mga lamok doon ng mga tao. Hindi siya livable. May some places, ano. Tapos, tong host factor, pag doon nag-i-increase daw, kasi balance, the word balance eh. Pag nag-i-increase yung mga tao, naapektuhan yung the agent factor, the environmental factor. Pag dumadami yung tao, nagiging pinuputol yung mga environment, some no, dumudumi or something like that. No? So nagkakaroon siya ng yung parang balance. And of course, the agent factor din. Pag dumami rin to, biological, minsan namamatay yung mga tao, minsan wala makain yung mga tao. So it affect the whole system eh. Parang ganyan yung explanation ng aming professor. Ewan ko tama yung pagka naalala ko yun. Naalala ko lang. Thank you. Take it back. Okay.
Yes. Thank you, Doc. Well, yeah, that was also being explained to us from our previous professor, Doc. And yeah, you're actually correct that if these factor is not, along with these factors are not balanced, then of course, parang maapektuhan talaga din yung dalawang factor. So,
Ay, pwede ako sumingot.
yes, Doc Amy.
Oo. Actually, parang yung isa ko pang pagkakaintindi, if these factors are actually in equilibrium, hindi nangyayari ang disease or illness. So, parang nagiging siya, ano yun, yung coexisting, parang ganon. So, kumbaga kahit meron kang agent factors, dahil maayos ang host factors mo at ang environmental factors mo, you actually don't get sick. Once you get the disequilibrium, that's when you develop the illness or that's when the community starts getting sick. Parang yun yung isang school of thought doon. So, kung yun lang.
Yeah.
Tama.
Din, Doc. Thank you, Doc Amy. Okay, so any other insights on the epidemiology triad?
Another no, yung sa example natin yung Singapore. Singapore, alam natin masyadong dikit-dikit yung mga tao doon. Di ba yung tingin natin sobrang dami ng tao. Actually, sa Singapore, meron silang reserve na area, parang forest na area. Parang meron silang reserve na water, na reserve silang para sa environment. So, still, even dun sa isang lugar, very siksikan, pero meron silang pinapangalagaan nila yung environmental area. No? Parang sino mag-iisip na magkaroon ng reservoir sa ilalim ng lupa ng sa dito sa Manila, only the BGC lang yata yung meron sa ilalim ng water meron silang ginawa dito sa BGC, parang ganun, similar with the Singapore setup, parang ganun. Pero ang Singapore, the whole area of Singapore has a so yung environmental factor yung meron silang dito. Kasi ang alam ko, siksikan dyan sa Singapore. Maraming tao dyan. Yung pala, meron pala sa Singapore na mga ganun, no? May mga, they preserve the environment also. Yun lang.
Thank you, Doc. So any other insights on the epidemiology triad before I proceed? Okay. So that would end my concepts of health, which is number 2 of my objective. Now let's move to health promotion. Okay, so Ma'am Amari, you're actually correct with your definition that it is the process of enabling people to increase control over and to improve their health. So it is a positive concept emphasizing personal, social, political, and institutional resources, as well as physical capacities, according to World Health Organization. Okay, so health promotion, we also have health protection. So to protect against non-environmental hazards. So in protecting ourselves from environmental hazards, there are some prevention, which there is a prevention. Like there are levels of prevention. So as defined here, that it is an action aimed to eradicating, eliminating, or minimizing the impact of disease and disability. So, and if none of these are feasible, retarding the progress of the disease and disability. So these are the levels of prevention. We have primordial, primary, secondary, and tertiary. Okay, so so let's go back first. Primordial prevention. This consists of actions and measures that inhibit the emergence of risk factors in the form of environmental, economic, social, and behavioral conditions. So, for example, I'll give an example for this one. Many adult health problems like obesity and hypertension have their early origins in childhood, because this is the time when lifestyles are formed. So, from the word from this example, since when we try to go to the primary prevention, this is defined as the action taken prior to the onset of disease, which removes the possibility that the disease will ever occur. It also signifies intervention in the pre-pathogenesis phase of a disease or health problem. Okay, and when we say, as you can see here on the diagram, so primary prevention achieved by, first we have health promotion, so under which we have the health education, environmental modifications, nutritional interventions, and lifestyle and behavioral changes. Now, on the other side of the presentation, we have the specific protection. So we have immunization or the zero prophylaxis. Uh, one best example of this is like, for example, the program that we are having, or the immunization program of the government. This is one way of preventing such disease to occur in the future of child. So we have the polio vaccines, the, what do we call this one? The MMR. Am I correct? We also have other vaccines or other vaccine preventable diseases that should, or that these young children should be immunized at the appropriate, at their appropriate age. Like, so we also have this one. We also have the use of specific nutrients or supplementations, protection against occupational hazards, safety of drugs and foods, and control of environmental hazards. Example is the air pollution. So example of that, for the specific protection, um, can can we have this an example, if we're wearing of masks uh, for the air pollution or some hazardous um, uh, factors? Can, I think, please correct me if I'm wrong, like wearing of contraceptives, or taking some drugs to prevent STDs and AIDS is also one of the primary prevention under specific protection, right, Doc Amy or Doc Hendricks?
Yes, yes.
Okay, so let's proceed to this. So as you can see, this is the health team. So it should be linked together to have, or to to achieve a positive outcome, or to to attain such healthy population. Because if these are not coordinated or not linked together, or if these health team or health workers will not coordinate with each other, then for sure, treatment, data, what else? Uh, Health teachings and other important things to promote health will not be achieved. So that is why these are or these health team workers should be linked together. Okay, now let's go to the fourth one, which is the risk communication. So disclaimer: the views expressed in this presentation are those of the author and do not reflect the official policy or position of the Uniformed Service University of the Health Sciences Department of Defense. Okay, this is just a picture. So the purpose of a public health response to a crisis is to efficiently and effectively reduce and prevent illness, injury, and death, and return individuals and communities to a state of normalcy. So that is also one of our main purpose as public health practitioner, or sooner or later public health administrator, to what to efficiently and effectively reduce such uh, trauma or illnesses, or some negative reduce negative impact to our, not just to our agency as agency, the Department of Health, but also impact to also to our community. Because if we cannot be efficient in doing risk communication, then we cannot attain this state of normalcy to our community. Okay, so risk communication, these some words here that were defined. So risk, when you say risk, so expose or someone or something valued to danger, harm, or loss. So what is health risk? Health risk is the probability that damage will occur as a result of exposure to a threat. Okay, so risk perception. So how do we perceive risk? Is being vaccinated has also a percentage of being at risk in our own side, or what can,
Yes.
yes or no?
Yes.
Okay, Doc Amy. Doc, si Doc Amy ba yon?
Oo, oo.
Okay.
Hindi si Noela. Hindi, joke. Oo.
Pareha kasi kayo ng boses ni Ma'am Josephine.
Ay, talaga. Ayan. Yes,
So, yes,
yes.
Doc, can you give us your insight about the perception, or how do people, or how you personally perceive being vaccinated with the risk?
Okay. So, in terms of science, wala kasi siyang pagka-absolute. So, ako, my personal take on that is, one, there's always a risk of possible adverse reaction.
Mhm.
Two, there's always gonna be a risk of still getting infected.
Mhm.
Three, there's still the risk of possible complication from the infection. And yung long term, so yung sa mga adverse reactions, so you have your initial, and
Mhm.
then you have your short term, and then you have your long term. No, so especially with the COVID, wala pang puro long term studies eh. So everybody who got the vaccine, 'di ba, parang sabi in the future na lang na parang all together will be discovering possible long-term adverse reaction
Reaction.
from the vaccine. Yun.
Okay. Thank you, Doki.
Thank you.
How about my other classmates? Do you think that we are still at risk, or how do you perceive being vaccinated
Ito,
in relation to health?
sa akin naman, since sa business side,
Yes,
with the Deng Bax, with the, ano yung sa China. Ito,
Sinovac.
of the record, no?
Ah,
Of the record. kasi mababa yung kanyang efficacy
Efficacy.
on the business side. Some country parang na sila, yung pag yun ang vaccine mo hindi ka pwede pumasok sa kanilang country, no? Tapos sa business side, on the business side aspect, kasi baka doble yung gastos ng Pilipinas eventually. Parang no, baka
Tama.
pag meron kang
Actually,
bakuna,
sir,
another vaccine pa, nire-require ka
Actually,
another
sir,
vaccine.
right now, di ba sir, may protocol na if you're getting Sinovac, after the 2 doses, you actually get a booster na kailangan either Pfizer or
Pfizer.
Moderna. Di ba?
Ayan,
So,
ayan.
at the end of the day, kung it would have been more cost-effective if you just got yung straight na Pfizer or Moderna. Kasi, in terms of price naman talaga, mas lumabas pang mas mura yung dalawa kaysa sa Sinovac tsaka sa Sinopharm.
Parang ganun, no? Related sa business. Parang
Diba?
ulitin mo ulit, parang ganun.
Wala kang magawa.
Magpapatest
Tapos sir, ano
ka
pala,
ulit. Parang ganun.
hindi lang sir booster shot. Pag Sinovac ka, kasi di ba you get yung Pfizer or Moderna, 1 dose lang. Pero, dapat you get it like yearly. Para na siyang flu vaccine. So technically,
panibago.
Yes, sir.
It's a risk talaga. There's a risk on that side.
Okay, thank you for those insights. Okay, so that was explained
Sir
for.
Gerald,
Yes.
pahabol sulat.
Ano po?
Sir, di ba ang tanong mo kung at risk pa rin ba tayo kung nabaksinan na tayo? Yun ba yung question mo, sir?
No, yung paano how do you perceive the risk of being vaccinated?
Yes, sir. Kung individual level, hindi natin masasabi kung safe ba tayo. Kasi different reactions dun sa vaccine. Meron tayong tinatawag din na cytokine storm. If I'm not mistaken, with regards to yung reaction natin dun sa infection. So kahit vaccinated na kasi tayo, di ba magkakaroon pa rin tayo ng infection. Pero kung magkakaroon ng herd immunity or kung halos lahat sa Pilipinas ay mababaksinan na, mape-prevent niya yung pag-i-evolve nung virus. So yun yung sa tingin ko kasi pinag-uusapan nila dati kung hindi mababaksinan yung large portion of the population, so malaki yung chance na mag-mutate yung virus into a more dangerous one. So kung ma-achieve natin at least most of the population is vaccinated, so yun yung mapiprevent na natin na maging more dangerous yung virus. So I think hindi tayo magiging too much at risk kung mababaksinan lahat sa Pilipinas. Pero na lang kung yung mutated virus na nanggaling sa ibang bansa na hindi na vaksinan, makakapasok ulit sa Pilipinas. So yung risk depende. So yun po, sir.
Thank you.
Hindi pa mamimit yung herd immunity.
Oo. Si Ma'am Amar ba yun?
70% no?
Si Josephine. Tsaka sir, not only yung percentage ng na-vaccinan, pero dapat, kasi sir right now, wala tayo naman na antibody testing. Di ba sir, kuwari tulad ng sa HEPA, di ba? Kahit sabihin mo na HEPA vaccine ka, di ba, pa-titer sila. Dahil non-existent yan, so we can never say na, hindi, na-reach namin ng 70%. Kasi kung yung 70%, sabihin mo, 40 or 50 lang pala ang nakaabot dun sa magandang, yung effective titer, kulang ka pa rin. Parang gano'n, oo.
Yung yung AstraZeneca ko, ang liit, hindi man lang umabot ng 1.0.
Ang alin?
Eclea test.
Sa Eclea. Kasi,
oh my.
Wala akong masabi. Pero sir, kasi diba? Sa Eclea. Ikaw ba, sir? Sorry. Sorry.
One ako.
Pero,
may Eclea. Mataas ang IgG ko na.
kasi sir, bukod naman sa vaccine, nagkaroon ka ng
correct.
pagkakaroon mo ng sariling antibody talaga.
Natural immunity.
Natural. Yeah, tama.
Ayan.
Tawagin mo si Noel, kasi tahimik.
Sir Noel, Sir Noel, ikaw na lang yung hindi nag-give ng insight.
Ay, sorry. Nagawa ba si Noel? Ay.
Okay. Yeah, I will ask him later. All right. So, thank you very much for your insights.
Gerard, the new trend kasi ng yung mga Gen X and Gen Gen Y, Gen Z. Yung ating learning is considered not a Gen X kasi Gen X ako, no. Normally sa amin, the teacher point of view palagi eh. Kumbaga si know-how palagi, parang si teacher. Pero sa atin giving expertise, opinion, no. Yun yung bagong learning ngayon eh.
Oo.
Lahat ng tao sa amin mga teacher, no. Sa lahat ng tao ngayon kino-considered as a know-how sila kasi at the tip of the sa kanilang mga kamay, they can search what is it, kasi Google yan eh.
Yeah.
Kumbaga malaman, kumbaga lahat ay may alam.
Pwede
So
naman.
it's a form of yung ating discussion, yan yung considered, hindi Gen X. Gen X, Gen na. Okay, thank you.
Okay. So, yeah, let's move forward. So, we already had the scientists or the risk managers business as evidence-based assessment. And for the general public, yeah, we were able to mention it also earlier with our discussions. Personal, the social, cultural, moral, and psychological, emotional aspect. Okay, so as you can see here, this is the figure of or the flow of doing risk communication. So first we have the event detection. Then we should do the risk assessment as to what is, for example, if like I will relate it to the AFI. Okay, so for the event detection, the patient has experienced adverse event following immunization. So we do the risk assessment as to what are the signs and symptoms, when does it occur, or when did it occur, what was the time, and those vaccination record coming from the LGU should be what we call reviewed, and then after which we do the control measures. So if the patient is manageable, or if the patient is just has or having a minor AFI, then uh, the patient will just stay in the post monitoring or post vaccination post for further monitoring. But if not, if it's serious, then we have to refer it to the nearest hospital. And of course, when the hospital, they have their own management, and after which the evaluation if the patient has recovered or not, and then it's just a what do we call this one? A in a circular motion. No, it's the flow is just going around. So after the evaluation, actually we must inform the LGU. We have to give feedback. There should be feedback. For me, in my own opinion, doing risk communication with this figure, there should be feedback so that the community will also know as to what was really or what really happened on that case, because they should also be informed and they should know, so that the integrity of the program or the integrity of such or whatever uh, program or vaccine or some activity.
Can I add something, Sir Gerard?
Yes, Doc.
Ito yung model ng talaga sa public health administration. Ito yung dapat meron tayong gantong bagay na marunong ka mag-assess, ano yung control measure na gagawin mo, ano yung evaluation mo, paano how to evaluate those project or measure na gusto mong mangyari. Tas at the end is the risk communication. Ito dapat meron tayo nito sa utak eh. Yung sa risk assessment, meron siyang meron technical know-how how to do the risk assessment.
Yeah.
Of course, meron kang mga data available. Yung ating mga kasama dito, very maraming data information na nasa computer. Paano siya lalaruin? How to extract those data? How to analyze it? No? Yun sana meron tayong ganong knowledge or competency. Paano siya isasiwalat? Kasi as of now, no, palaging hindi hearsay eh. Meron tayong data information. Public health kay Sir Gerard, sa iba pa sa inyo, mayroong kumpletong data. Yun ang problema eh. Paano siya i-extract? How to analyze? Yun yung missing link eh. Siguro yun sa public health administration, ma-develop yung ganun nating aspect. May competency aspect eh. Competency, for example, you know how to do the FE info, SPSS, data, their statistical treatment, no? Tapos meron ka nitong, or simple Excel.
Yun.
Marunong ka nito.
Data management, parang
yes.
ganun.
Yes, oo.
Pero
Tapos,
kasi ang struggle lang kasi, some datas are not really available to everyone, especially sa mga, like for example, sa COVID, or sa, like for
may
example,
privacy. Yan.
may privacy kasi.
Data privacy.
Really,
Pero with that, even walang data privacy, kung pwede nating laruin dito, no, very, pwedeng laruin siya. I know some of you know how to do that. Sana merong mapulot kayo doon sa yung paano ba 'yan? Paano ba gamit ng tawag dito, statistics.
Actually, Doc, I am also handling the FTA or the BG Flow account of the region. So, lahat ng, kaso nga lang, yung sa akin lang is yung nag-AFI lang talaga. So, pero actually, meron din ako dun sa CBCR, yung tawag ng CBCR, yung lahat ng na-immunize, pero I'm not sure if I am allowed to extract the data kasi baka ako doon, mapong ako
Hindi sa ating learning. Pwedeng you-share it, pakita mo lang, pero offline na lang natin para wala naman para makita how is it, no, as a manager, as a administrator. Yun yung know-how dapat. Nagtataas si Doc Amy. Go ahead.
Actually, sir, yung sa yung sa public health surveillance is actually similar to your quality management. Na if you do a project or meron kang action sa isang lugar, tapos nun, di ba, titignan mo, tapos nun, di ba, kaya siya nagiging cycle. Tapos nun, whatever problem, tapos nun, you do research, tapos you evaluate, tapos nun, you improve, you impose change, tapos nun, uulit si cycle. With the change, ulit siya ulit. Supposedly, sa ginagawang move ng government na to have everything na merong ISO or nag-establish na mga quality assurance team, supposedly, pati sa mga projects. Ang nung, parang sir, di ba, yung dapat sa research, is yung magko-compare ka ngayon ng isang project, dapat medyo similar, na kunwari, na walang quality, tapos yung quality assurance, tapos yung isang meron. Tapos ang titignan niyo yung difference. So technically, sir, nasa sistema, talagang mahirap siguro, sir, tsaka classmates yung implementation. Kasi lalo na pag nagaganyan, yung pag nagsabi ka na ng mga nagiging problem, may mga taong hindi makaka-appreciate yan. Ito nga, in the specifics of, syempre off the record. Granted, we compare the vaccines for COVID. So those who are pro Sinovac. Sa Hong Kong na lang, wag na lang sa Pilipinas, kakabi na may pumaril sa akin dito. Kunwari yun sa Hong Kong, okay. Sa Hong Kong, dalawa lang. Sinovac and Pfizer. Eliminate nila yung iba pa. So, ang ano doon is, kunwari, nagbigay ka ng sobrang gandang feedback about Pfizer in a territory of China. You will know what to expect. Yung susunod na mangyayari sa'yo. Parang ano lang yan kasi, di ba, kunwari, ganun yan So, yun yung pinakaminsang fear ng ng mga taong nag-evaluate. Kaya minsan, it just stops Kasi parang, hindi mo naman pwedeng sasabihin na kung yung sinong in-endorse, kunwari, ni government mo, siya yung mas may mga magagandang qualities. Okay, kunwari nagganyan ka, nag-assess ka, na siya yung mas hihigit doon sa isa. May mga times na hindi. So ngayon, kunwari, sa Hong Kong, kunwari, doon sa assessment nyo, ang lumabas ang mas hindi maganda is Sinovac, would you do you think we will have the guts to voice it out nang alam natin na pwedeng tinapos mo na yung career mo or pati ang buhay mo with that move. So the very root of yung pinaka-problem ng kahit anong sistema, whether it be health, sobrang kang malalagay sa alanganin. So which is napakalaking problema talaga. Diba? So I think that's yung pinaka-problem. Kasi even naman with the quality, di ba sir, makikita niyo naman, di ba, classmates, ang dami ng mga naka-ISO, even sa Middle East. Pero makikita niya may mga may mga pinapaktawan yan. Yung mga medyo may tatamaang sensitive na sabihin mo pa nga department or institution, mapapaktawan yan. Kasi merong iba, kunwari, magagamit din siya sa ibang ayaw nila. Kunwari, sabihin na hindi, kasi dito sa mga evaluation, so and so, yung mga ganon. So, yun yung pinaka-problem in the proper reporting. Kunwari, Gerald, sa inyo, sa level nyo, pwedeng ni-report nyo lahat ng tama. Sa tingin nyo, pagdating sa kanataas-taasan, ganun pa rin yun. So, tinagal-tagal ng management ng COVID, nasa health tayong lahat. Do you think it could have been better or managed better? There could have been something better na nagawa, no, to improve our situation right now. Parang ganun, 'di ba? So, meron kang parating mga question mark. So, along those route, may mga intersection niyan na minsan ayaw mo nga tawirin because meron ka pang pangarap sa buhay mo. Parang ganun. So, that's reality So, pinaka-nakasakit sa ulo talaga. Kaya, yeah.
Yes, I agree with you, Doc Amy, because working. And I think also Doc Hendricks also would also acknowledge that practice na, even though we religiously give the correct data in our locale, but when we are not yet sure if after we send it out to the central office, are they
gonna report it?
Yeah.
Diba? Or hindi na ba na-falsify tapos bigla na lang may office na masusunog. Yung mga tipong gano'n. So, yung mga sad truth of sad reality.
Okay, nagtatas ng kamay. Mina.
Yes, Doc. With regards to data. Actually, sa ministry or sa organization ko, data is very important. But unfortunately, most of the nursing leaders, they don't know what is the importance of data, especially before our team was bago na develop yung team namin. So every time they will request something, it is yung judgment nila is based on talk, not necessarily based on the data. So when our team came in, so we actually meet all of the nursing leaders, show them what the data they need in order to really judge the situation, because most of the issues in, for example, in ministry is that it's mostly management issues. It's not necessarily I need staff because da, 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 da. But when you look into the patient volume, when you look into the census, the acuity of the patients, lumalabas na they don't need staff. They're actually overloaded with staff or they're overstaffed. But they feel that they are parang may shortage sila ng staff because their management is poor. They don't actually manage their staff well. Most of their staff, when we dig into the data, most of their staff is not actually doing their task. Instead, they're doing non-nursing tasks because the doctors or the physician will tell them to do this, to do that, which is actually outside of their scope. So, ayun po. And actually, we developed a data book that will help the managers to actually see what's happening in their hospital by month and quarter, and the summary will be the overall, the year-to-date data. So, yeah, yun po. And yun. If you want, I can share with you just a screenshot of what we developed, but it's very huge.
Yes. Sige, sige. Okay. Paano mo yan? Pakita mo yan mamaya. Saka na. Let's look on that.
Okay.
Kasi maganda yan eh. The new trend. Even yung uso, di ba, is a dashboard palagi. As a manager ka, meron kang dashboard palagi on your computer.
That's what we
yung
actually did, sir. So we actually did the initial part. We actually did it through an Excel and do the dashboard through Excel. And we're planning to take it to the next step, which is having an online dashboard instead of a manual one. But then we cannot link Cerner into the company who will do the dashboard. So there's a conflict between the two companies. So we're still negotiating.
Yan ang Mina, ang problem kasi with the top management, they don't know how to extract those information. So, yun yung link nyo is to bigyan mo agad ng initial ng stat, di ba? Yung important stat dun sa level nila. Yun ang dapat eh. Yun ang kulang sa atin.
Yung
sa Pilipinas.
ganun, sir. Pero
ganun yung sistema. Ang dashboard lang natin, Gerard, is ilan ang cases, ilan na bakunahan. No?
Oh yeah.
Yun lang Yun ang dashboard natin. Pero different area has different dashboard, different needs. Siguro in the future, 10 years from now, we can adapt those sistema ng Saudi, ng ibang country.
Pero yes.
Yeah. Okay. Mahaba pa ba yan, sir?
Let me just konti na lang to, sir. 5 slides na lang. Okay. So under the let me just play. So under the IHR, risk communication of public health in emergencies includes the range of communication capacities required through the preparedness, response, and recovery phases of serious public health event to encourage informed decision-making, positive behavior change, and the maintenance of trust. See, so the last word there is trust. That is why it's very important to do risk communication. So the key points here for health risk communication. So we have operational communication versus communication with the public. Involves exchanging information about the real or perceived health threats. Provides information on expected positive or negative outcomes and their probabilities, and helps to stabilize information environment. So these are our key points in doing risk communication to our serious cases for AFI, that we always explain and reiterate that the vaccine is for this age group, and they are the ones being favorable uh, in having or acquiring safe or secure from being severe to critical state if they will be infected of COVID-19. Okay, so here, so just let me just run down quickly based on the crisis emergency risk communication. So these are the core principles. So first, be first. So crisis are time sensitive. So you should be right. Accuracy is essential to credibility, and be credible. So when you do such thing, reflect honesty and truthfulness. Express empathy, promote action. So what will be your or it doesn't mean that you give assurance, but you try to give uh, some some what do we call this one, some words wherein that this or like the agency will not be neglecting this event, but we will further investigate it so that you can have a full and comprehensive answers basing on the report, something like that. And then of course you have to show respect to the individual or to the patient as well. So avoid humor. Okay. So there are failures also for the risk communication. So we have the information released late, no? This is really happening due to some circumstances, like for example, late of releasing of documents from the hospital. So of course, the investigation team will also be, or the investigation will also be hampered, and that will also lead to the late of releasing of the information. What else? The mixed messages, paternalistic attitude, not countering myths and rumors in real time, and public power struggles and confusion. So, what is the main enemy here for the risk communication team is actually the social media. This really affect a lot of the accuracy or the efficiency and the utilization rate of our vaccine program. Okay. So,
Nagtatas ng kamay si ano,
oh,
may nagtatas ng kamay.
Yes,
Si
sir.
Noel,
Noel po.
Noel.
Yeah.
yes, Sir Noel.
Sir, regarding dun sa released information na late or
Mm-mm.
something like that,
Yes.
and with the along with the social media or mainstream media,
Mm-mm.
regarding dun sa dengue vax, parang ganun lang yung gusto kong sabihin.
Mm-mm.
We already know, or the DOH or specific focal person of different areas, they have already idea kung anong real na nangyayari during that time
Mm-mm.
after the introduction of dengue vaccine sa mga patients, especially those children na nagkaroon ng problem. And then pagdating sa taas, it's like parang they concealed all the information, and nung hindi pa inilabas ng public attorney's office yung real situation na marami na pala yung mga incidents ng ganito, parang parang may issue tayo sa information kahit na you're doing all your best na, 'di ba, trying to improve the system, di po ba? Parang yung nakakwento mo during the dengue vax ganito nung Sir Gerald.
Yeah, actually, sir, that is not kanang new no to the to this kind of work kasi nga they are, as what Doc Amy said earlier, that there are also some agency needed to be protected or something, like the person itself, parang ganon. So it's really hard because it's really hard for us, and that is what turns out, like the Dingbaksha didn't really succeed because of these failures. Kasi if they just do it as quick as they could, then probably meron pa silang magagawang mga solutions on that. And however, yun nga, since dito lang tayo sa region or sa ibang lokal, the central office really has the right to divulge such information. And I don't know on my behalf as to what is the reason why they cover it or they conceal that information. So yeah.
Okay.
So sir, siguro ang part ng communication failure is concealing of information.
Mm-mm. Siguro.
Ah,
Yeah. I am.
That would be the number one part of communication
Oo.
failure.
Yeah.
gusto mo tawagin ko si Rosette. Kaibigan ko yun eh. Si
Kaya,
Berhere. Personal na.
Especially this time of COVID times, Doc. Do we really believe with the statistics in each country na talagang yun po talaga yung mga statistics ng country?
Yung kay Denbach siya, no, I think, well, minsan, putting a stop to kahit ano pang usap-usapan. Kasi ang nangyayari minsan sa atin, specifically sa Pilipinas, no, may mga tao who actually finds achievement in putting blame on yung nagawa ng tao. Pero actually, tao nga, di ba? That's why you have the system of kind of improving. Well, in fact, dapat you should think at the back of our mind na nung ginawa nila yon, nung nag-purchase sila at saka nung mga binigay siya sa mga bata na technically hindi siya pandemic, no? Pero there are like really sobrang dami rin cases na the purpose is true naman, no? Unfortunately, siguro may mga na-miss na points, no? So, minsan, dapat yung moving forward Kaya lang kasi may mga tao, imbis na gusto nila ng sabihin nilang accomplishment, yung pagkakamali ng iba, doon na lang nagpo-focus, no? So, yung kay Denbach siya talaga, I think, ganun talaga minsan ang science, no? Kahit sobrang parang ang ganda-ganda, sobrang ideal na siya. Parang sa mga pasyente, sa mga doktor, kahit of the best of hands, minsan pwede mamatay ang pasyente. Pero not necessarily din gusto siya ng doktor na mamatay. Diba? Parang ganun din. So, I think yun lang no? So, parang dapat in the process lang, talagang we really try to improve the system, yung whatever we can control, kasi there are really some uncontrollable forces
Yeah.
So, yun, diba? Tapos, we move forward.
Risk versus the benefits.
Correct. Diba, sir? Totoo, diba? Kahit naman sa legal. Diba, kahit sa legal, diba? Basta ang pinaka-concept mo is you do no harm. So, kung sa umpisa, alam mong gusto mo siyang patayin, doon nagka-problema. Pero kung sa umpisa talaga ay maganda, wala namang problem. Teka, huwag ka mag-recite. Teka, ayun. So, kaya diba, yung ganon. So, pag nagkaroon ng litigation yan.
Nagre-recite yung aso mo
Oo, nagre-recite siya, sir So, kunwari, diba, sa court, diba? Kasi nagkaroon ng litigation, pero the intention was not bad. Diba? So, I
Siya
think,
naman daw.
Oo nga, nag-aral din yun, sir. So, yun. So, di ba, ganun. Yun lang. Parang ayan na nga, mumute na nga ako, sir.
Siya naman daw.
Okay. Well, thank you. Thank you for that, Doc Amy and Sir Noel. So, Doc Hendrix, I think I am taking too much of the time already. I have your social media. I'll just share it to my friend or to my classmates on these two remaining points kasi baka wala ng time yung ibang reporter. Doc?
Okay, sige.
Okay lang po ba or shall I continue or baka...
Okay. Sige, next na lang, topic.
Sige po.
Tingnan mo pa, i-run down mo yung slides mo. Okay. Next. Next.
Saka ito na lang din. Ito na yung last, yung sa creation of IEC material.
Sa creation of IEC materials, you do normally kung merong group na gumagawa nito na yung magagaling talaga sa mga multimedia, mga collaterals. Pero I think ito parang galing na lang yata sa mga yung mga ready-made na di ba?
Ang yung
Canva, mga gano'n, Canva.
Ay, Canva to po.
Canva to. Kayo na yung gumawa.
Tama.
Kasi meron mga proper way of laying
Layout,
ano,
yes.
layout. Kung ano ba siya, pang multimedia, pang flyers. Ito parang pang book yata kasi na everything's naando na sa ano na yan.
And then,
Parang rule na yata sa social media, hindi wala ng text eh.
ano po?
Parang rule na ngayon,
Oo. So,
wala ng text.
they would prefer social media through Facebook talaga. Kasi parang accessible nila. Kung may wifi, makakapag-communicate na rin sila. So, yes.
The power of social media kasi even ikaw lang mag-isa, yung powerful niya ay maraming na nakakakuha, maraming even isang ano ka lang, isang nurse or isang doctor, pero if you nagpe-Facebook or YouTube marami kang followers, marami nakikinig, di ba? Nagiging powerful siya. Yun ang powerful ni social media.
Actually, I am coordinating with the local parang YouTuber, but hindi pa man nag-reply. So sabi ko, oh my God, I cannot wait for him. So I'll just move forward na lang po.
Di ba yung collaboration?
Collaboration talaga.
You have information, pero pag siya yung nag-deliver, mas
parang,
maraming para artista siya. Sila ang mga artista ngayon, hindi na yung artista.
Malawak yung ano niya, reach.
Correct.
Sa atin.
The reach. Kasi yung mga ganyan, binabayaran sa YouTube, no, yung pag-post ng mga ganyan. Kung sino yung mga target audience sa social media marketing, sino yung social audience, anong area, ano yung likes, ano yung mga hilig ng ano. They can filter out kung sino yung mga tao.
So actually, coordinating with some ML players or yung parang mga Mobile Legends players na nagtawag nito? Anong tawag diyan? Anong tawag diyan?
Nagba-vlog, nagkagaano.
So they have also they have a lot of following also, so that would be better as well. Parang ganun. Well, Doc, thank you. That would be the end of my report. Thank you, President.
The next presenter, thank you. Bigyan natin ng 5 baksak virtual clap for Sir Gerard. Virtual clap. Reaction clap. Okay, next presenter.
Hi, Doc.
Yes. Ikaw na, Ma'am Mina.
Kung wala po si Miss Beverly, actually si Miss Bev sana.
Ikaw ang for second, ikaw ngayon. Tama ba?
Opo.
Okay. Take it away.
So, continuation lang ng topic ko last week. So, it's about, I'll be discussing interprofessional collaboration, transforming public health through teamwork. So, this is my updated course syllabus. So, actually, mali intindi ko last time. It should be one topic. So, I just focus in the core interprofessional concepts. And we'll start with the introduction. In interprofessional collaboration, actually, we have 2 concepts that we have to understand. The first is interprofessional education, which occurs when students from 2 or more professions learn about, from, and with each other to enable effective collaboration and improve health outcomes. Interprofessional education is a necessary step in preparing a collaborative, practice-ready health workforce that is better prepared to respond to local health needs. Collaborative practice happens when multiple health workers from different professional backgrounds work together with patients, families, carers, and communities to deliver the highest quality of care. It allows health workers to engage any individual whose skills can help achieve local health goals. Collaborative practice, It strengthens the health systems and improves health outcomes. So there are 4 core competencies in interprofessional collaborative practice. So we have the values and ethics, roles and responsibilities, interprofessional communication, teamwork, and team-based care. So values and ethics, this is actually a new concept based on IPEC or IPEC, which is from the United States, which states that interprofessional values and related ethics are patient-centered and build on a separate profession-specific core competency in patient-centeredness. The roles and responsibilities, we have to understand how professional roles and responsibilities complement each other in patient-centered and community population-oriented care. Interprofessional communication, communicating refers to aspects of openness, style, and expression of feelings and thoughts. These communications are directed specifically at modifying teamwork aspects. Team-related communications exploit opportunities that influence team interactions, organization, and functioning. So teamwork is different from team-based care. Teamwork is the levels of cooperation, coordination, and collaboration characterizing the relationship between professions in delivering patient-centered care. Team-based care, ito yung usually, for example, in a hospital, we have a group of people designated for that task, like a rapid response team, palliative care team. So the care delivered by intentionally created, usually relatively small work groups in healthcare who are recognized by others as well as by themselves as having a collective identity and shared responsibility for a patient or group of patients. So in interprofessional collaboration, we have differences, but then we have a shared approach. So for example, as you can see here in this diagram, these are the nurses, the medical team, and the AHPs. So we have a different knowledge, we have different skills, we have different expertise, personal attributes, different problem-solving styles, care philosophies, professional culture, and professional contribution. But then at the end of the day, we have the same goal, which is improving the health outcomes for our not only for our patients, but for the community or for the whole population. So this is the framework which the WHO which the WHO developed last 2010. So it's the framework for action on interprofessional education in interprofessional collaborative practice. So as you can see here, the framework starts on a local health needs. So there is a need. After that, there is a fragmented health system. And then there is a present and future health workforce. So papasok dito yung mga students, not only new students who will be new to the profession, but who's also those who already nurses or a healthcare worker. So they will go into interprofessional education, and then they will be a health workforce at the end result. And then this health workforce will be a collaborative practice ready. And then if they are already collaborative practice ready, when they will go into their role or into their job, then they will be a collaborative practice. They will practice the interprofessional collaborative. And then the result of that is a strengthened health system that will then improve the health outcomes. So here there is 2 concepts on this framework, which is the education system, papasok to dito sa interprofessional education. And we have the health system, which is under the collaborative practice. So as you can see, it starts on the population, and the population have their needs. Like for example, here in the UAE, when we assess the needs, of course, we have, especially ngayon during COVID, India is locked down, Philippines, we cannot get workforce, and other countries, we cannot get workforce. So we actually need nurses. So that's why the Ministry of Education, the Ministry of Health, and other authorities or stakeholders, they're developing a plan to increase the capacity of the university so that the most local students will enter the nursing field or the nursing studies, so that they will increase their workforce, because the demand is that we need workforce, nurses from UAE national, because if you look at the data, there's only 8% of UAE national in nursing field, so it's very low. And then you'll have the demand, the provision, and then supply of health workforce, because the education system, at the end of the day, they will supply your workforce. So the other part is the health system. Of course, the population will have the need, the demand, the provision, and then of course the health system will demand for a health workforce. That's why they will take from the education those who are ready to join the workforce team. So this is
Pakibalik nga yung ano. Actually, magandang framework na to. Hindi pa sa Pilipinas kasi yung needs ng industry hindi pa tinutugunan yung ng education or mga Department of Health Hindi pa ganun kaganda ng connection, pero maganda tong framework na to kasi para matugunan kung ano yung needs talaga ng healthcare system. Very specifically dun sa mga profession Hindi pa ganun kasakto. Pero kung masutugunan yan, kasi kung tatanong mo sa sarili mo na nag-aaral ka, yung tinuro ba dun sa edukasyon ay yan ba yung tinuro nung college or nung ikaw ay naging doktor or naging nurse? Or ngayon mo lang natututunan because na andito ka sa nagtatrabaho ka na. Dapat merong connectivity between the education system at saka nung CHED, para may connectivity. Ito yung kailangan namin, parang ganun. Ito kami si industry. Ito po yung kailangan naming tao. Dapat yung tao na to ay merong gantong kakayanan. So ito yung si ikaw naman sa university or sa school, tutugunan mo yung pangangailangan na yon. The best thing nga is to yung mga related learning experience, connected dun sa mga hospital. Hindi pa ganun ka smooth sailing, kaya nagkakaroon ng overproduce na mga na mga staff sa mga tawag dito. Kasi karamihan, di ba, nung time na sobrang daming nurses, sobrang supply.
Yes.
Yun. Hindi yun yung demand ng industry Hindi pa ganito Pero I think maganda kung magka-collaborate with the industry and the CHED. Ayan. Okay.
So next slide po, this is a framework which the US or the United States IPEC developed from the framework of WHO. So as you can see here, again, you have the education system and professional system. And when we talk about professional system, andun yung collaborative practice, which is goal is to enhance patient care outcomes, and the interprofessional education is to enhance learner outcomes. So as you can see here, there are different factors that affects the educational system or interprofessional education. So we have the institutional factors such as leadership, resources, administrative processes, and also we have the teaching factors, the learning context, and the faculty development. And as you can see, the outcome for the educational system is health professional learners. So we have the collaborative ready worker. And after that, in professional system, we have two factors, the organizational factors, which is the governance and structuring clinical care, and interactional factors, which is sharing goals and visions, sense of belonging. And the outcome of the professional system will be patient-provider organization system outcomes, which is improving the health outcomes. So as you can see, both ng educational system and professional system, kung makikita nyo sa baba, it is research to inform and to evaluate. These two systems will actually be involved in the research because, of course, we should base our judgment and decision on evidence-based or evidence-informed. So this is what they have developed. So this research to inform and to evaluate, understand the process related to teaching and practicing collaboratively, measure the outcomes or benchmark with rigorous methodologies that are transparent, and disseminate findings. So there's a mechanism of interprofessional education. And this what affects the education. We have two mechanisms. Educator mechanism, as you can see, these are the factors that affects that, which you have the staff training, the champions, institutional support, managerial commitment, and learning outcomes. And then you will have the curricular mechanism, which is logistic and scheduling, program content, compulsory attendance, shared objectives, adult learning principles, learning methods, contextual learning, and assessment. So ito yung sample action plan which WHO developed. So for example, for the mechanism of IPE, the action is to agree to a common vision and purpose for interprofessional education with key stakeholders across all faculties and organizations. So your participant with regards to this action will be the decision makers, the policy makers, health facility directors, educational leaders, educators, and health workers. So for example, here in the UAE, you will have your Ministry of Education, you will have the universities or the deans involved, and the managers or the hospital directors, etc. And then you will have a level of engagement, which is contextualized vision, whether the students are in the classroom or participating in practice education. Interprofessional education will be encouraged and collaborative practice principles upheld. So the potential outcome for this action is that the all health worker education is directed by an interprofessional vision and purpose. So there actually maraming nakalist, but then I did not take all of that because that would be very long. And my goal for today was actually to share you that document. It's a 64 pages document from WHO. And actually, when I actually read that, it's very interesting because when I studied, I didn't actually study most of these interprofessional topics. So I suggest classmates that you read that because it's very helpful, especially if we're going to pursue this public health into our practice. So second is mechanism of interprofessional collaborative practice. Of course, there's two factors that or two mechanisms that affects the collaborative practice, which is the institutional support mechanism, working culture mechanism, environmental mechanism. So three mechanisms. So under institutional supports, we have the governance model, personal policies, shared operating procedures, structured protocols, supportive management practices. Under the working culture, the communication strategies, conflict resolution, shared decision-making process. And last is the environment. Of course, build an environment, facilities, space design. So sample action plan of WHO is structure processes that promote shared decision-making, regular communication, and community involvement. So of course, your participants on that action will be your health facility managers and directors and your health workforce. The level of engagement is to discuss and share ideas for improved communication processes, develop a sense of community through interaction and staff support. And the potential outcomes of this action is a model of collaborative practice that recognizes the principles of shared decision-making and best practice in communication across professional boundaries. Actually, with regards to IPC, I actually noticed when I read this principle is that here in the UAE, we actually lack collaborative practice. And later on, I will ask you guys or classmates to actually share your input about this topic because I know we are in different practices. It's like some are in the clinical, some are especially even different part of clinical. So we have rad tech, we have nurses, we have the management with us. So actually, I want your input with regards to this topic as how you see your teams working interprofessionally. So benefits of IPC. The first is collaborative practice can improve the access to and coordination of health services. It can improve the appropriate use of specialist clinical resources. It can improve health outcomes for people with chronic diseases. It can improve patient care and safety. Collaborative practice can decrease total patient complications, decrease length of hospital stay, decrease tension and conflict among caregivers, decrease the staff turnover, decrease hospital admissions, decrease clinical error rates, decrease mortality rates. In community mental health settings, collaborative practice can increase patient and carer satisfaction, promote greater acceptance of treatment, reduce duration of treatment, reduce the cost of care, reduce incidence of suicide, increase treatment for psychiatric disorders, and reduce outpatient visits. So this is like a diagram of the benefits of IPC. As you can see, the it will have benefits in team performance, staff satisfaction, the quality of care, better interaction, communication, and cooperation, and the delivery of health care. So there's interprofessional learning domains based on the WHO. And again, you have your teamwork, where the team will be able to be both team leader and team member, knowing the barriers to teamwork. And you have the roles and responsibilities, where you have to understand one's own roles, responsibilities, and expertise, and those of other types of health worker. And communication, expressing one's opinion competently to your colleagues, listening to the team members. And you have your learning and critical reflection, where you're reflecting critically on one's own relationship within a team and transferring interprofessional and the relationship with and recognizing the needs of the patient, working collaboratively in the best interest of the patient, engaging with patients, their families, carers, and communities as partners in care management, ethical practice, understanding the stereotypical views of other health workers held by self and others, acknowledging that each health worker views are equally valid and important. So these are the sample of contribution of IPE and IPC in some of the urgent health challenges. So actually, hindi lang to yung contribution niya. There are lots, but this is just a sample. So it will have an impact on family and community health, because health workers who are able to jointly identify the key strength of each member of the healthcare team and use those strengths to manage the complex health issues of the entire birthing family will play a key role in reducing these alarming and preventable statistics. Because it's mentioned there that every day 1,500 women worldwide die from complications in pregnancy or child health. It will also have impact in HIV, AIDS, tuberculosis, and malaria, because the detection, treatment, and prevention of global diseases, the interprofessional team that have the expertise and resources to tailor their response to the local environment will be critical to the success of disease management programs, education, and awareness. And also, it will have impact on health action in crisis, like in situations of humanitarian crisis and conflict. A well-planned emergency response is essential. To overcome water, food, and medical supply gaps, health workers must have the knowledge and skills to mobilize whatever resources and expertise are available within the health system and the broader community. Interprofessional education provides health workers with the kind of skills needed to coordinate the delivery of care when emergency situations arise. So there are also issues and challenges when it comes to IPC, or interprofessional collaborative practice. So that the first one is realizing the value of IPC, or interprofessional team collaborative, and interprofessional education and training, different professional cultures, professional identity, power, and structures, roles and responsibilities, and some are human factors. As we all know, like for example, here in the UAE, the leaders actually they're not, they don't know what is the value of IPC. And for example, here in the UAE, for nurses, we just developed the scope of practice, the scope of service for each hospitals. We just developed recently the job description of all the nurses, so you can actually see the gaps there. If your health workers, they don't know their scope, they don't know their job description, they don't know the scope of their service, then it would be very hard to collaborate with each other. That's why you have a fragmented healthcare system. So that is one of the issues I saw in the Ministry of Health. And that's only for nursing part. So you have, currently we are developing the scope of practice, scope of service, and job description of pharmacy, physician, and other healthcare professionals. So that's why up to now, if you'll ask me, Ministry of Health still have a lot to do to actually reach or to actually start or to have a collaborative practice ready health workforce. So these are the examples of IPC. As you can see here, in 2005 in Pakistan, there's a severe earthquake resulting in thousands of injuries. So that's why relief efforts were particularly challenging in isolated mountain communities. So a wound clinic was eventually opened within a partially constructed hotel, but had no source of water, making infection control extremely difficult. One of the volunteer health workers took the initiative to locate a trained plumber who was able to provide the clinic with a constant source of clean water within 48 hours. In this situation, seeking expertise outside the conventional healthcare team ensured earthquake victims were able to receive quality health services in spite of the difficult circumstances. This is the common occurrence in emergency situations where collaboration across sectors can be essential to improving health outcomes. Another example is the family health teams in Brazil. In Brazil, the reform of the national constitution in the late 1980s saw the establishment of SUDs, Unified and Decentralized Health System. This led to the creation of family health teams, which are comprised of a doctor, 2 nurses, and community health workers. The teams are responsible for monitoring specific number of families in defined geographical areas for a range of health needs. 20 years after the establishment of SUS and 15 years after the implementation of Family Health Team Program, for more than 88 million Brazilians are followed by 28,000 family health teams and 16,000 family oral health teams. In 2006, the National Primary Healthcare Policy reaffirmed the commitment of the Brazilian government to the expansion and consolidation of the healthcare network in SUS on the basis of a broad base of family health teams linked to the population. My last example is a health workforce satisfaction and well-being, in where the health workers in Australian and English primary care teams have reported high levels of well-being upon implementation of IPC. They share problems and support each other, and the resulting cooperation buffers individuals from negative workplace interaction. So actually, IPC promotes your work environment. So this is the examples of literature review. Actually, if I'll have a student, I will actually do this. I'll give them literature review, and this is just an example. So systemic review on interprofessional education effects. This is the study. This is the study objectives. And this is the result, and this is the author conclusions. So I wouldn't read that. I'll give, as I said, I'll give you the resources that I have, so you can actually read that.
Yun
So
yung
these
ano,
are the... Yes, Dom?
yung balik mo sa dati, systematic review is ginagamit to sa research on not a meta-analysis, but a review of literature, no? Marami siya. So,
Yes, Doc.
ginagamitan ito. So, yung reader ay considered ay panel. Babasahin nila to, tapos another, dito sa isa pang column. Nilalagyan pa ng column. Ano ba yan? Positive or negative? Parang ganun, no? Marami silang binabasa. This is example ng systematic review.
Yes.
So, ito
Yes,
yan.
Doc.
Para sa meta-analysis ng ito na yung quali naman. So, both ginagamit siya for yan ang ginagamit nyo, sistema on the systematic review.
Yes po, Doc. Okay po, Doc.
Okay. Sige.
And these are the examples of case studies referring to the interprofessional collaboration. And this is actually by country. So I just took this as an example. So for example, in Canada, the practice setting, family practice teaching clinic located in urban settings. So who is involved? Of course, you have your patients living with chronic and mental illnesses, and for healthcare, for the health workforce, you have your family physicians, mental health workers, nurses, nurse practitioners, nutritionists, pharmacists, public health nurses, receptionists, and social workers. So what are the challenges and facilitators? In Canada, they see that the challenge is that they have a lack of electronic health record, and also there is interpersonal conflicts, lack of structured protocols. But their facilitators that they have a good remuneration models, a governance model that shares responsibility between professionals, and they have interprofessional rounds and committed leadership. So this is just an example. Again, I will not read this all. I will give you my resource for this. So based on what you told me, Doc, I actually take Philippine and compare it to other country. I actually would like to show you a diagram of how it is here in the United Arab Emirates, but then as I've said, UAE is very fragmented in terms of healthcare, so they don't have a unified workflow with regards to COVID-19 contact tracing. So this is, I got this from DOH. So this is how the contact tracing works. So it will start in disease reporting units, which is actually from hospitals and community centers. And then it will go to the local health office or LESU. And you will have MESU or CESU CT teams or contact tracing teams involved, plus your call centers. And they are responsible for call the cases to list close contacts, identify exposure history. They have to encode close contact line list in contact tracing info system. And they have to analyze areas of exposure and list of potential places of sources of infections. And after local health office, it will go to the local LCTTS or local contact tracing teams. So again, these are the involved teams or involved workforce, which is CESU, MESU, city teams or contact tracing teams, the rural health physicians, public health nurses, barangay health workers, other contact tracers, and your barangay units. So they are responsible for call or visit close contacts to inform and profile close contacts, advice for quarantine, isolation, and self-monitoring. And the next is from local team, it will go to the LGUs or BERTs, and the involved health workforce will be, or the team will be the LGU staff, PNP, BFP, POPCOM, barangay tanod or officers, and other contact tracers. And then they will be the one responsible for monitoring the quarantine status, monitoring health status. And here the LGU action is to disinfect closure of establishments, appropriate NPI measures. And lastly, it will go to the local health office or LESU for release of certificate of quarantine completion, swab the close contact who becomes suspected case. So your team members will the members will be the CESU MESU swabbing team, city health officer, rural health physicians. So this is in Philippine settings. So as you can see here, there is a side note that PNP, Barangay Tanod, and other LGU units enter the picture if close contact cannot be located, non-compliant to quarantine protocols, and need to be transported. So yun po is in Philippine setting, and I took the United States for comparison. So this is the workflow in the United States, and this is from the CDC. So it will start the positive test results of COVID-19 or COVID-19 case report, and then the report will go to the health department, and the patient will start self-isolation. The case entered into a data system, and then it will go to a case triage, or it will go to the case manager they will assign a staff to do the patient interview. And during the interview, we make sure that the patient knows his or her test results. The patient identify the contacts. Of course, we refer to the patient to a medical provider if there is a severe symptoms, and they actually refer patient for support services for their foods, for their grocery item, for any needs of the patient like medication, etc. And the patient will continue self-isolation, and they actually follow up the patient on a daily basis and refer if there is a need for referral to the medical provider. And after that, the patient discontinues self-isolation. For contact tracing, this is the workflow. So the patient with COVID-19, she or he will be interviewed. The patient identify the contacts, and then again, the case manager will triage for the assignment, and they will assign to the local contact tracer. The contact will be notified. They will test the contact, and they will make sure that the contact has sufficient supplies of food, water, hygiene supplies, and refer the contact to healthcare worker if necessary. And test available and aligns with of course, they will test the contact. So if it's positive, they will undergo the same workflow, and the contact begins self-isolation. If it's negative, then the contact will quarantine or self-quarantine, and the contact discontinues self-quarantine after 14 days from last exposure if asymptomatic. So that is the difference. Actually, it's the same concept,
The same din.
but yung title lang ng mga involved na professionals are different.
Ang pinakaiba lang dito yung sa grocery.
Yes, Doc. And actually, in US, of course, in any other country, we have different titles for our workforce team. And in Philippines, I see that because in Philippines, we have different hierarchy in the government. So we have a lot of involvement starting from the we have the MESU, the CESU, the bird or the barangay units, LGU. So
emergency.
yes.
Response
So
team.
yun po. Actually, here in the UAE, I did not prepare a diagram because in Ministry of Health, for example, I took a PCR, COVID PCR, and it will be positive. We have a system and a mobile app. It is called Al Hosen. So it will pop up there that I'm positive. And once it's pop up there, whoever have that application will, if I go out or if I didn't quarantine or I didn't know that I was positive, the community will know that I'm positive because it's like a radar. There is a radar, and it will notify the population that you have someone near you who is positive.
Galing.
And actually, they got that idea from Korea because I think South Korea started that. And they build a system based on that system. And with regards to the workflow for the surveyor, we have the PMD or Preventive Medicine Department. They have a surveillance officer. So once the result comes from the laboratory, they will send the positive patients to the PMD or Preventive Medicine. The surveillance officer will receive that, and after 2 to 3 days, they will start calling those patients, and they will call them to visit the PMD branch so that they will lalagyan sila ng Q watch. It's actually a GPS watch so that they can actually see where if the patient will go out of their home or if they will parang hindi nila susundin yung isolation protocol. And after that, they will give health education or education to the patient, what they need to avoid, what they have to do during their isolation, and they will let the patient sign a waiver. And after that, the patient will go home. She will continue with the isolation. And also here in the UAE, we do not provide any support services if you will self-isolate in your home. The UAE will only provide supplies if you will be admitted to the isolation center. So once you finish your quarantine or your isolation for a period of 10 days, then you have to go to the PMD to get a certificate that you are negative. So actually here, they don't do a swab like after you finish your isolation. Kasi dati like the initial COVID phase, it's like 14 days, and then after 14 days, you have to get the swab, and then finish, you have to go back to the community once you're negative. But then right now, hindi na sila nagsuswab.
Same with the Philippines na.
Yes, Doc. And sometimes we're actually receiving a report that, for example, there is one nag-positive siya, nag-quarantine siya for 10 days kasi 10 days na lang ngayon. And nakakuha na siya ng clearance letter from the health office. And after that, nung mag-join na siya sa work niya, sabi ng work niya, you have to do PCR because we don't want to take risk. So yung nag-isolate, nag-positive pa rin. So parang kine-question yung guideline. So meron pa rin cases na gano'n.
Oo, maraming case na gano'n sa Pilipinas. Even mga 3 buwan na nga sila dun sa sa motel. Ganun pa rin.
Hindi ko ba yun sa cycle? Sa cycle ng virus. Kaya dapat kasi sir yung PCR, dapat ina-identify nila yung cycle number. Kasi talaga sir yung
3 months
sir, kapag 3 months sir. So talagang magpa-positive talaga sir. Kaya lang, yung iba kasing RT-PCR sir, wala yung cycle count eh. Kaya akala nila basta mag-detect positive pa. Yun nga sir, nami-mislead, nagkakaroon ng
meron pang sa katawan. Yung sinasabi. Pero not necessarily infectious siya.
Infectious, yeah, correct. Tama po.
Okay.
And
nagtataas na si Noel. Nagtataas ng kamay.
Yes, sir. Share ko lang po kasi last time parang dahil nag-positive ako, kasi yung protocol dati like what Miss Amari said, after 14 days, kailangan magpa-PCR ka. And binago yon kasi meron pa rin parang traces ng infection.
Yes.
Meron kang magiging reactive ka. Parang levels of hindi ka na infected. Pero yung level nung yung CT threshold or something like that.
IgG.
Yung value nun, yung value nun is parang mababa pa din. So, kapag mababa ka, it's either reactive ka at bumaba ng 30 is active yung infection or infectious ka pa din. So, just to avoid professionals not going to their specific jobs, tinanggal po yung parang pa-PCR ulit kasi reactive pa din ang result nun.
Ikleya ang mas maganda.
So yun po, parang ako, although curious ako dahil baka may bata dito sa amin, nagpa-PCR ako and they told me, ba't ka pa nagpa-PCR? Reactive naman yan result mo, sabi ganun. So, okay. Kaya pala nagbago rin yung Ministry of Health na guidelines because of that. Kasi kailangan pag reactive ka, magko-quarantine ka pa rin for 7 days. So, it's a waste of time and resources sa Ministry of Health. Parang ganun. Yun lang po.
Actually,
Alright.
Doc, just to add on Mr. Noel's, on what he said, actually, for us in the UAE, kasi meron kami, just for an example, last week, may nag-positive sa ka-work ko. And they actually advised us to do PCR. And usually our protocol is that if you have a contact, then you actually have to isolate. If you have the vaccine, then you just have to isolate for 5 days. If you did not have the vaccine or you only received the first dose, then you have to take 10 days. But then what I knew is that hindi siya applicable, yung protocol na yon or yung guideline na yon, hindi siya applicable sa healthcare worker na staff namin sa ministry. So if our staff is having a close contact with someone, they will just, wala na silang quarantine. They'll just do PCR. If it's negative, then they will just resume to work.
Sir, correct ko lang, sir, yung terms. Actually, sir, yung sinasabi ni Noel na CT, yan ang cycle threshold. So, pag konti, ang cycle threshold mo, ibig sabihin mas marami kasi, sir, yung viral load mo eh. That's why, yan ang infectious ka. So, pag tumataas ang cycle threshold, ibig sabihin kahit nakailang beses sila ng cycle, bago na-detect yung viral load, ibig sabihin mas konti ang viral load, so not necessarily na infectious. Pero kasi yung reactivity ng patient, I think, is more appropriate sa mga antigen testing. Yeah. Parang si Rocco yan, sir, di ba? Nung nagpa-admit siya sa PGH. Yan, sir. Oo. Reactive ako. Yun lang.
Thank you. Meron ba? Okay.
Hello po.
Thank you. Thank you, Mamina, for sharing.
Doc, I have a question to my classmates.
Ay, kami tanong Sige.
Actually, I want them to share kung paano yung, if they see, dun sa current work team nila, because we all have teams. So did you notice that you're actually practicing interprofessional collaboration in your group? Or how is it? Like, for example,
nung nagkaroon ng COVID, parang ngayon na-appreciate yung collaboration ngayon.
Correct.
Ngayon nagkaroon ng pero nung dati walang pakialam diyan eh. Ngayon ultimo from barangay, LGU, no, from local government to Department of Health, talagang merong collaboration eh.
Yes, Doc. Oo.
Parang na-develop ngayon.
Tama.
Share ko lang po, Miss Amari. Doc?
Yes po.
Doc Index.
Go ahead.
Regarding po dyan sa interprofessional collaboration, like, ang radiology side kasi is more of technical aspect. Ngayon po, during this pandemic, ang mga technologies, mga technicians were pulled out to serve as mag-conduct din ng swab or PCR test. Not only that, nag-assist na rin sila sa pagtawag sa mga patients ng mga for vaccination, mag-input ka na rin ng sa database ng ministry. So yung napaka-important po ng collaboration between professionals, although hindi yun ang nature ng work, but it can ease the workflow ng isang system na binibuild ng isang government or institution. Yun lang po.
Yung parang ngayon sa Marikina, mga dentist siyempre hindi na makapagbunot. Di ba? Ang ginawa nila, sila yung taga-swab, yung mga dentist. Sila, mahilig sila buka bibig, di ba? Magaling sila
Tama.
Ito. Sila ang taga-swab ngayon. Kasi hindi naman sila nagbubunot ng ngipin. O yan. So, yung talaga.
Dito sa dito naman sa sa Mindanao, yun nga nang dahil sa COVID, merong work yung mga health allied, especially yung mga rad tech or yung mga psychology, parang ganon. So binigyan sila ng I mean like the COVID gives them opportunity na to explore other than their usual parang tawag nito job. And then we actually collaborated with the BHERT. Some of us we went to some LGUs to conduct technical assistance with regards to sample collection. Yung time na talagang spike yung cases namin dito sa region. So we asked the some midwives and to take on the technical assistant program para at least hindi na sila kasi sometimes kasi yung medtech ng sa LGU isa-isa lang. So pag ma-COVID wala nang taga-swab aside from nurses, yung mga nurses sa LG, yung mga NDPs natin, they were also assigned to some TTMF. So they have to parang yun yung best option na to at least to augment sa sa workforce. It really helped a lot.
Yung tanong ni Mamina, no? Thank you, Gerard. Yung tanong ni Mina about the nung araw yung time pa ni Marcos, yung kasagsagan ng tuberculosis, if you're familiar with that, merong kinreate ng job opportunity for the sputum canvasser. So that time kasi ang tuberculosis parang active case finding pa nung araw eh. Ngayon naging passive case finding na lang ngayon, no? Kung sino yung may simptomas, kung sino yung pupunta ng health facilities, doon lang isuswab. Pero nung dati, time ni Marcos, kasi active case finding, kung sino yung may sakit, yung sputum canvasser ang taga-kolekta ng mga plema sa family. Nung araw is the same din na nagagampanan nung araw pa. Medyo naging detailed na ngayon. Kasi because of the technology, because of the system, referral system. Alright. Okay, thank you.
Sir, pwede pong magdagdag po yung doon po kay Ma'am Pay.
Okay, sige, go ahead.
Sir, kasi hindi ko lang po matanggap yung yung result ng data nila Ma'am Pay na sa hospital po yung overstaffing daw sila and then yung mga nurses walang ginagawa. Baka po kasi may mali doon. Sir, sa data na nakuha nila kasi kagaya yung mga nurses sa hospital, hindi lang naman po pagbibigay ng gamot yung work nila doon, yung work namin doon, kundi yung pati kami din po yung bed making, kahit may nursing assistant na sir, yung bed making, yung paglilinis ng mga sugat, yung pagkuha ng mga kung ano-anong data, mga input, output, lahat po yan. Tsaka dagdag na rin po yung napakaraming sandamakmak na mga dito na mga documentation. So sa totoo lang po, never pa sa mga hospital na nangyari na overstaff at walang ginagawa yung mga nurses. Kaya po,
actually, you take it into a wrong way. Actually, I said that they're overstaffed, but I didn't say that you're just sitting there not doing anything. The problem is the non-nursing tasks. You're doing tasks who is not for you. It's actually data collection should not be under nurses. It should be under the managers of quality and the unit managers, the nurse managers, and the assistant director of nursing affairs. But they actually give that task to the lower in the hierarchy because they know they will follow. But accepting that task means that you're not doing what you're supposed to do. That's why you have your job description, and what you have to do is only that which was on your job description. So yun yung nakita namin. There is no issue with the workforce, with the numbers, and actually you're overstaffed. But then the issue is that the management is abusing their workforce. They don't follow the job description. They don't do their supposed jobs, especially for the managers, for the quality department, for the statistical department. They all give the task to the nurses because the nurses always say, yes, I will do it. Even if it will consume their own time for that supposedly they should give to the patient. So yun yung problema, management siya. Hindi siya, not necessarily the nurses are not doing anything. Actually, the nurses are doing lots of things because I think by nature, all of the nurses are very polite and just listens to someone who's higher than them. And they feel that I am in charge or I'm the one responsible of doing that. But the truth is you are not. Like, for example, what we have seen is that they're giving like, for example, as you said, bed making, we have assistant nurses who should do that. So why you're doing that? So you should actually give that task to the appropriate member of your team. So that's how you actually work collaboratively properly. So you don't, if you're doing all those tasks, then what the others will do. So they'll just sit around and do nothing. So that is what we found. And actually, it's not only bed making. Like, for example, nakita namin pharmacy department, they're not doing their job. They're assigning their tasks to the nurses because they said, they're the one who will give the medication, so let them do all of the things that they have to do or that we have to do as a pharmacy to, and for example, I'll give you one example in OPD. So OPD, the nurses should only be in the assessment room. They will collect the vital signs, the subjective objective, etc., etc. And after that, they will have to go to the doctor. Now, the physician will always tell, I need one nurse to be with me. But actually, by workforce, you don't need a nurse to be with you because what the doctor will ask the nurse dun sa OPD, the doctor will tell the nurse, okay, just sit on my, upo ka dyan sa computer ko, type everything, encode the patient name, encode the diagnosis, encode this, and just to do his work. So that is actually wrong because you're
Okay, sige.
So yun po, yun yung nakita namin. It's actually not and as I said earlier, the issue is management, how you use your workforce and how you give the task. Not because if you will calculate the workforce of nurses, then that should be based on your patient volume, not based on your responsibilities and all, because nurses, it's correlated to your nursing hour per patient day or what the patient requires from your side. So that will include everything, the care, the documentation, and everything.
Hello, ma'am.
Okay.
Ma'am, pwede maka-interrupt. Kaya naman po namin ginagawa yung mga ibang tasks. Marami pong factors. Kunwari yung sa pharmacy or yung pagbibigay ng gamot, tsaka yung mga yung bed making. Kunwari kung hihintayin mo pa yung assistant nurse na gagawin niya yon, madi-disrupt na yung trabaho mo. So yung next na yung next na shift, sa'yo magagalit yun. Sa'yo sila magagalit kung hindi nagawa yung mga tasks na dapat gawin. Tsaka po, kunwari, meron din sa mga documentation, meron din doon kung nagawa mo na ba to, nagawa mo na ba yan. So, we want to be honest also na nagawa na namin yung mga bagay-bagay bago namin ito i-document. Kasi once kahit dinocument mo tapos hindi naman nagawa, doon ka naman malalagot sa next na shift. Sila naman yung mas mahihirapan. So, no choice kami, ma'am. Tsaka yung job description, alam naman po namin yan. Meron naman na sa bawat area merong protocols na dapat gawin. Kaya lang, ma'am, syempre iba-ibang factor, iba-ibang system. Tsaka yung sa mga boss, hindi ka din naman makahindi kasi papahirapan ka din nila, bibigyan ka nila ng wrong schedule. So maraming factors po kaya kami ang naiipit minsan. So
yes,
much better.
Actually, that's the problem. As I've said, nurses is very polite in nature. They don't talk back. But actually, I think nurses should start to defend themselves because we are actually overused. I am a nurse, so I know how it feels. But when we do our analysis, then we actually found out that the managers are mismanaging or misusing the nurses. So instead of actually helping a patient, they're actually helping the boss to get what they need to do.
Actually, ma'am, kasi minsan hindi din alam ng manager yung gagawin niya. May mga manager kasi na naging manager, not because of experience, but
Yes.
because of palakasan system or something. So,
Yes.
hindi nila alam gagawin nila. Hindi nila alam
Actually,
yung trabaho.
that's the main problem here in the UAE. Just to I'm just being honest and clear. The UAE have a lot to develop, and actually, as I've seen,
Okay.
like for example, in terms of their national, like for example, kaka-graduate lang ng lokal, they're national. So instead of starting from the starting position, which is staff nurse, they will jump to being. They will be staff nurse for some period, like 1 year. And then after 1 year, they will go to the admin and they will say, I need higher position. So they will
Okay.
go and jump to charge nurse or unit manager that they actually don't know how to do that tasks. Especially in ministry, we just introduced those new titles 2018. So it's very new and everyone is adapting very slow because the COVID started and we did not have a proper line manager course. So, but that is our plan. We have to professionally develop our leaders, including the ADNA, unit manager, nurse manager, nurse supervisors, till charge nurses, because they will be the one managing the floor. So yon. And I'm talking on behalf of Ministry of Health facilities, not other facilities, because in UAE, as you know, you have your SEHA, you have DHA, DHCC, you have your Presidential Affairs, which Sheikh Khalifa was bound to. So those hospitals are not under us. So I'm just talking on behalf of Ministry of Health hospitals or the federal hospitals, not other facilities.
Okay. Thank you. Thank you, Ma'am Mina. Thank you, Ma'am Josephine. For sharing your insight. No? Iba talaga yung mga Pinoy eh. Gagawin lahat. Lahat-lahat. Kahit
Actually,
nahihirapan.
hindi lang po, Doc. Hindi lang Pinoy, Doc. Actually, you will see a lot of nationalities, but the only nationalities who will refuse to do tasks is actually Arab nationalities. They will refuse like anything. Even if that's their task, they will refuse.
Ganyan talaga sila.
But Indians, Filipinos, and other Asian, they'll just tell, yes, okay, I'll do that.
Yes, I do that. Tama. Other country din, yung mga national, mga lokal, sila yung matitigas. Anyway, sino yung susunod na reporter? Thank you, Amina. Meron
Thank
ka
you
pang...
po, Doc. Not only that, Doc.
Ay, sorry, Faye, sorry.
Okay, Mamina.
Wala
Okay.
na po, Doc. Thank you po.
Okay, thank you.
Sir,
Next.
sir, wala. Kasi sir, dapat
Dalawa
po
lang.
Thank you, Ma'am Mina.
Tatlo eh. Kung si
Okay.
JJ. Kasi sir, si Debs yung nagpaalam. Sir, si
Okay.
JJ daw, na-toxic sila kasi may dumating na malaking group ng food poisoning.
Oh.
Oh,
Food
sir, so
poison.
ready. Actually, sir, ready daw siya sa report. Kaya lang, sir, hindi siya maka-alis. Nag-later dun sa
Sige.
patients.
As a health
Oo nga.
administrator, how do you
Sorry.
malaking group ng food poisoning, how do you call that
Oo.
sa report? Sige nga.
Ay, Gerald, sumagot ka.
Anong tawag doon? Case?
Ano yung
Anong tawag doon? Mga nagkasakit.
malaking group?
Attack rate, di ba? Attack rate.
Mm-mm.
Attack rate. Are you familiar with that? Naalala niyo pa ba yun? Incidence, prevalence, different incidence and prevalence,
attack rate,
mortality, the maternal maternal mortality rate, mga rates and ratio. Yun ang bread and butter nyo dapat bread and butter. Ito is you use the attack rate. Attack rate in the denominator is the all na kumain. For example, yung food poison, spaghetti. No? Sino ang kumain ng spaghetti? Yun lahat na expose. Sino yung nagkasakit? The numerator is the nagkasakit. Ang denominator is yung kumain. Yun yung expose. Yun ang ano.
Bali, sir, yung may symptoms, tapos yung buong
Symptom.
population exposed to the
Yes.
same,
Anong sa handaan? Ano ang denominator mo?
yung lahat ng guests.
Lahat ng
Tama.
kumain. Lahat ng
Yung
kumain.
included.
Tapos anong kinain mo? Spaghetti, ano yun eh? Spaghetti, adobo, lahat. Sine-check yun lahat. Tapos sa numerator, sino yung nagkasakit? Yung nasa ibabaw, yung mga nagkasakit. Yun, from that mapifilter mo yung attack rate. dapat ito yung bread and butter natin. As a health administrator, yung mga maternal mortality rate, neonatal mortality rate, neonatal at saka IMR. Ano yung IMR? Infant mortality rate. Mga specific death rate. Specific death rate. Mga rates and ratio. Kasama ba siya epidemiology na discuss?
Yes.
Hindi sure, ano? Oo. Tapos, nasa mga reports namin.
Tapos ngayon, di ba, positivity rate na familiar kayo, di ba? Yung mga rates and ratio, positivity rate, yung mga dinidiscuss sa news. How is it? Parang ganun. Bakit ganun? Bakit konti yung cases? Bakit ang daming cases pero bakit sinasabi nila mas maganda pa yung cases natin compare with other country? Ang dami-dami nating cases. Parang ganun. Kasi we're talking about the population. No? Per 1,000. For every 1,000 population, there is a, death. Ganun. What is different between incident and prevalence? Anyone?
Specific time.
Yes. A specific period of time. Yes. Pag incidents normally is yung mga incidents ng dengue. Pero yung mga old and new, the word old and new prevalence, ginagamit old and new. Anyway, na-discuss na yan. Alam nyo na yan. Wala nang presenter.
Sir, wala po. So, bali sir, next week, sa si JJ, tapos sa si Bevs, tapos isa na lang, sir. Kasi sir, di ba tatapusin mo naman ang buong July. Kasi sir, may webinar po pala.
July,
sir.
Kailan tatamaan ba yung time natin?
Sir, hindi sir, yung webinar
Sunday
tungkol
yan,
sa research, opo sir,
Sunday,
18. Opo sir.
Saturday naman tayo.
Opo.
Hindi, tapusin lang natin yung mga reports. That's it. Okay
Opo.
na. Tapos,
hindi sir, so bali ilan ang gusto
up.
nyo, sir? Kasi sir, yung sa kabilang subject, sir, in-extend na rin ng July.
July tayo.
Opo.
Matapos natin yung July.
So, dalawa lang din, sir, sila. So, si JJ tsaka si Bevs.
Depende kung ano yung discussion natin. Pwedeng umabot ng 3.
So, standby lang, sir, si Michelle. Okay.
Tapos, kung if you need to, kasi merong dapat competency yung gusto ko sana yung competency on how to use the date. Siguro, kung sino sa inyo, how to use the software available. Paano gamitin si Excel? Paano yung paano i-transfer? Yun yung basic Dapat meron tayong ganun. Apo.
Doc, I will share our data.
Ayan.
Just for a screen.
Sige nga.
Actually, I have to leave kasi merong kaming study about monoclonal antibody therapy for COVID today, but they adjust. So, I think I will have 10 minutes. 10 minutes.
Pakita mo lang.
Pakita ko lang po.
Tanggalin ka lang na, stop sharing na lang. Baka ka mapagalitan
So, actually,